Hello and welcome everyone to Good Mental Health Podcast Series, episode number 7. So today in this special episode, I'm going to talk about the difference between psychologist and a psychiatrist. There are many clients and many people in general who do ask me the difference between a psychologist and psychiatrist. So there are a number of questions I've been always asked by my clients. So I thought to bring this up in my podcast so that many people can get aware and have the clear understanding about the difference between the psychologist and psychiatrist. So the number one thing that I usually hear from my clients that do I prescribe medicines? So where my answer is always no. I want to tell you why. Because I am a psychologist and psychologists are not supposed to prescribe medicine because we have not had any educational background into medicines, right? So psychologists, they do treat people with psychological conditions and with the use of psychological treatments, including counseling, including the number of therapeutic sessions by using the therapeutic techniques, right? So this is what my answer is to, if I prescribe medication. So definitely we don't prescribe medication. So there is one more question I do hear out from my clients, that is, can psychologists diagnose mental illness? So yes, we can diagnose the mental illness because we psychologists are trained to diagnose the mental illness. We can definitely diagnose mental illness. So another very common question that I always come across with is, are psychologists called doctors? So psychologists are not medical doctors like the psychiatrist. This is a clear understanding. Everyone's supposed to be really having a clear picture. We are mental health professionals. When we talk about psychologists are mental health professionals in their field. So they are not doctors, they are not called doctors, but they definitely are mental health professionals. So, okay, this is the difference, and many people get confused. They just don't have the idea, or maybe you can say that they are not psychoeducated. They are not fully aware that who are psychologists and who are psychiatrists. So in the time of need, when they are dealing with any emotional health problem or a mental illness issue, they doesn't understand that whom to seek help from. So this is a very important thing for everyone to understand. So when you know the difference that psychiatrists are into medication and psychologists are into treating their patients with counseling and therapeutic sessions. So I guess, this is somewhat can give you the clarity. So another thing what I want to add on here for your more understanding is that both psychologists as well as psychiatrists, they do understand how the human brain works, what are emotions. Also, they both know what are feelings, what are the thought process, the thought pattern. So both of us do know all of these things, human brain functioning, the emotions, the feelings, the thought process, how does everything work. We both can treat the mental illness by using the psychological treatment. But when we talk about the psychiatrists, they do involve medication as well. So both psychologists and psychiatrists can provide, the range of psychotherapies. But when we talk about the psychiatrists, they treat patients largely by prescribing medication. So now I hope you have the clear picture, whereas when we talk about psychologists, we mainly focus on providing therapeutic sessions, and we do provide our patient different therapeutic, treatments, the therapeutic treatments such as CBT, cognitive behavioral therapy, REBT, rational emotive behavioral therapies, or another behavioral therapies, psychotherapies. Also, there are a number of modalities that we do use, right? And counseling is one of the powerful tool that helps to find the root cause of the problem and to help fix the patient's emotional health concern. So this is the difference between the psychologist and a psychiatrist. So, hence, at the end, I would like to say that psychologists are basically trained mental health professionals with a license, right? That is how they get the power to treat the patients, to help people come out of their emotional health concerns. They both can, can play their own roles in the field of mental health, wherein psychologists can work with by using their therapeutic sessions, therapeutic treatment, and psychiatrists can add or involve the medication. But both work for treating the patients with mental health conditions. So you hope you all had a great and clear understanding and the picture. Wishing you all have a very sound, very good mental health. With this beautiful note, I would like to thank you all for listening and have blissful days until we meet next time. Take care, Rabraka. Hello and welcome everyone to Good Mental Health Podcast Series, episode number 7.